All right, welcome to Medicine and Surgery Course Mastery. We call it MSc Mastery. We call it MSc Mastery, where you master medical concepts and concerns in medicine and surgery. Now, for today, we are looking at a part of the course in medicine called thorax. Thorax is usually studied alongside with abdomen, pelvis, and perineum, called TAP. TAP in Nigerian Medical College is usually studied in the second year, in the second semester of the second year medicine and surgery. Okay, so this tab has been giving a lot of persons some concern, and we feel we should reduce the concept of this to a sizable note that a student can use and prepare for exams. Now, remember, thorax is something you need to understand what it means. Thorax has features. Not only that, thorax, okay, also have composition. There are things that make up thorax. Now, as we talk about thorax, there is an extent from where to where is a thorax. As I also talk about thorax, you must understand there are structures that are found in the inlet, okay, where you call entry, and structures found in the exit. Thorax has function and also have joints. These are the things, except for the outlet, that we'll be considering in this shot. Okay, so the meaning of thorax, you can see it here. Thorax, see, you can see it here, the definition of thorax. You can see thorax is a trunk located between the neck of the abdomen. It's a region of trunk located between the neck and the abdomen. All right. Now, this trunk, watch this now, okay, is a skeleton, all right, that join two other skeletons to make up the axial skeleton. The other two are the skull and the vertebral column. Although the vertebral column, part of it is studied in the thorax, abdomen, perineum, and pelvis, a part of it is studied in head and neck. So skull and part of this vertebra is studied in head and neck. Moving away from there, we said we have the human skeletal system. When you have the axial skeleton and the appendicular skeleton, two of them make up the human skeleton. This is human anatomy. Are you following? Good. You can see it here when we said axial skeleton, skull, thorax or thoracic cage, skull, and vertebral column. Are you seeing now? Now we look at the features of thorax. Thorax has features. Number one feature is we use the acronym SMSTTD. That is SMS teacher till daybreak, SMS teacher Tony, SMS teacher today. Yeah, you can say SMS teacher today or SMS TTD. SMS teacher today. That's message your teacher today. I'm your teacher, message me today. Subscribe if you love more of this. Moving away from there, we said you have the composition, you have the specific sternum structure and the classification. Okay, so as you move from the features of thorax, we talk about the composition of thorax. Okay, see the feature skin. After your skin, if you dissect the skin, the next thing you find is the superficial and deep fascia. After that, you find muscle. After that, you're going to find what? Thoracic wall. Then if you can appreciate the thoracic wall, you find thoracic cavity where the visceral organs are. So moving away from that, we talk about thorax. Thorax is made up of, it has two basic joints, as the costovertebral joint and the transverse joint. Are you following? So moving away, you see composition. Three things make up the thorax: the sternum, thoracic vertebra, and then 12 pairs of ribs. Time will fail me to tell you from thorax what T1 to T1 makes up the thoracic vertebra. Okay, of course, T1 to T12. Now you have the structure of the ribs. Okay, three things make up the ribs, and they have their clinical importance. Right? So you have the rib classification, can be true ribs, false rib, floating rib. It can also be typical or atypical ribs. All right. So we pause here at this point. Make sure you take your time, say it and repeat it one by one. As you listen to it, you pause, write out. As you listen to a post workout, I want you to give thumbs up and subscription if you want to see when we are taking internalization session of this. Thank you.